Thank you for coming, and thank you for staying after hearing that John isn't here. I'll do the best that I can. I'm not as well versed as John, but I've been working with him for a number of years, so I hope that gives me some street cred. And this is his presentation, so I hope to do it justice. Today, we're planning to talk about herbal anti-inflammatories and analgesics. Analgesics are painkillers, another term. Beginning with Hippocrates and Galen, so they were the ancient Greek physicians that we gain a lot of information, and our modern medicine is really based upon these people. We still take the Hippocratic oath. We have to say that as a part of our graduation in naturopathic college. And so way back in ancient Greece, they already had information and knowledge on tissues and what impacted disease. So they said these in Latin terms: calor, rubor, tumor, and dolor. Have you heard these terms before? No, so I'll explain some of it. So calor is a term for heat. It's just a Latin for heat. So, sometimes if we have a fever, we know something's going on. Our body creates heat. Rubor is redness, right? So redness is a response of the body tissues to an injury or irritation. In medical terms, it means that the blood vessels are dilating to allow for more blood into those areas. So sometimes if we don't really know something's going on, if we see someone and they're red and hot, it could be a symptom of disease. Thirdly, tumor. So these days we associate the name tumor with disease or cancer, yeah? But in fact, it can just be the accumulation of fluid to an area. So when the body is trying to heal itself, first it moves cells and attention into the area that's impacted, that's the heat. Then the blood vessels dilate, creates the redness, and then as more cells are directed to that area, there can be a swelling. Short-term swelling is very healing. It's when swelling is long-term, or those fluids don't have a way to move out of the area, that cysts, soft tumors, and eventually hard tumors can develop. All of these three categories can lead to pain, and should we ignore all of these, eventually leads to death. This tells us that, so Hippocrates, Celsus, and Galen, they map the main symptoms associated with pain and tissue dysfunction, and even the symptom patterns leading to cancer. So that's the heat, redness, accumulation of fluids. Dolor, or pain, we don't consider it necessarily a disease state, because pain can be subjective, Pain we can also use analgesics or anesthesia to block the transmission of pain. And that's how we can do surgeries, right? We can take organs out without a person feeling it in their nervous system or registering that pain, even though major surgery is happening, and we're grateful for that. We're really grateful for that. However, in cases of chronic pain and tissue inflammation, when we are just using analgesics to mask that pain or cover up that pain, sometimes we're not aware of how much damage can happen to that area. So we as herbalists and naturopaths, while we'd like to ease some of the discomfort that comes with inflammation and tissue injury, we also need to address the question of why. Why is that happening? Why is that happening? And once we can figure out why it's happening, we need to try to address those underlying causes and help them. So I hope to convey to you today some ideas of how to address the why. Inflammation. So this is how inflammation affects the body. Inflammation is a natural defense for us. In acute situations, that means short term, the body's immune system is mobilized in a defense against damaged cells or viruses and other invaders. So, we get a cut on our finger one day, and within a few minutes it becomes red, possibly inflamed, and then as more cells move in to help heal the injury, we might feel a little bit of pain. And then as the tissue heals, we don't even know that we cut ourselves a couple of days ago. So that's how inflammation works in acute situations for healing. Chronic inflammation is what we see now as the major factor in all of chronic disease at the moment. Heart attacks, heart conditions, Alzheimer's disease, chronic Crohn's disease or inflammatory bowel diseases, and fatty liver. All of those things can be addressed by addressing the underlying chronic inflammation. Sometimes this inflammation can go on for many years at a very low grade, and we might not even notice it directly. We may feel a little bit achy, or we may feel a little bit of joint pain. We may be more sleepy, but we may not realize the impact that it's having on us. So, what can I say about this? So this is how inflammation affects each part of the body. In the brain, the pro-inflammatory cytokines, which are cells that the immune system uses to help tissue repair, but long-term can lead to more inflammation and autoimmune reactions in the brain that leads to depression, autism, poor memory, Alzheimer's, and multiple sclerosis. So that's in cases of an overactive immune system, creating more inflammation. in the cardiovascular system, we're now measuring, and there's a test that is used as a marker for people that have had heart attacks called high sensitivity C-reactive protein. And so it has been used as a marker for cardiovascular events. But we as naturopaths and doctors are using it as a marker now for people that we suspect have inflammation. And so should you have that tested, we want that number to be 1 or under 1. We feel inflammation in our muscles. People sometimes have fibromyalgia, chronic pain. Can also manifest as carpal tunnel syndrome. In the bones, we can have inflammation or an accumulation of fluids, and eventually we can feel rheumatoid pain or osteoarthritis. In the skin, chronic inflammation can lead to eczema, psoriasis, acne and boils. The thyroid is a condition, autoimmune thyroid conditions I see a lot of, and oftentimes it's an autoimmune response or an overactive response of the immune system that ends up attacking the thyroid. And usually, if we can address the immune system and the digestive system and help to support the thyroid, it can really drastically improve. In the lungs, chronic inflammation can lead to asthma and allergies. In the digestive tract, to Crohn's disease, irritable bowel, acid reflux or GERD, and celiac disease. Celiac disease is an autoimmune reaction to wheat and gluten. In the kidneys, too much inflammation can lead to high blood pressure and edema or fluid. Usually when the kidneys aren't functioning as well as they can, we see a fluid build up around the ankles or around the shins. And the liver inflammation can make the liver grow bigger because it has more to do, and it can also lead to fatty liver disease because of the increased toxic load and buildup in the body, which creates more inflammation. Okay, so sometimes people use analgesics, Tylenol, Advil for pain, right? And so while these analgesics can help relieve some of the pain in the short term, again, if we rely on these things in the long term, they can actually make things worse for us. Some of the side effects of non-steroidal anti-inflammatory drugs, or NSAIDs, are increased risk of cardiovascular problems, heart failure, liver failure. They're really hard on the kidneys and the stomach. I have patients who use Advil even just once or twice. You know, they have a tooth pulled, or they have a terrible headache and they need to go to work or do a presentation. And they notice within just a couple of days of using Advil that it changes their entire metabolism in their digestive tract, and their bowel movements change. Sometimes they even notice their bowel movements are black, which is not a good sign. We've also seen some of the side effects can be what we call a leaky gut. So that means inflammation in the digestive tract. Inflammation in the digestive tract that leads to small gaps or intestinal permeability, so that foods that should not get through into the bloodstream before they're metabolized and identified in the liver, end up getting through, these particles end up getting through with the intestinal permeability. The immune system ends up recognizing them as invaders and then attacks them. And this leaky gut can lead to autoimmune conditions down the road. So when we talk about inflammation, the part that is inflamed, whether it be the joints or the lungs or even the skin, we often also need to address the digestive tract. That's where most things can start. So let's see. So foods that lead to more inflammation include refined grains, whole grain, whole flour, especially sugar and refined grains. We often advocate for more whole grains in our practice. Deep fried foods for sure are really hard on the gastrointestinal tract and the liver. Grain-fed meat and eggs, fast foods, soda pop, and most commercial salad dressings, margarine, soybean oil, corn oil, canola oil is a big one too. So now, what can we do to help stop this inflammation? We want to move to more anti-inflammatory foods. One thing that John didn't put on this chart that I often tell people, dairy, yes. Can you think of anything else? It's actually a family of foods that are more pro-inflammatory. Yeah? The nightshades. Have you heard of that before, as nightshades being pro-inflammatory? Do you know, can you name any of the...
Tomatoes, eggplant.
Tomatoes, eggplant, peppers. What am I missing? Potatoes, that's right. White potatoes. Sweet potatoes are okay. So typically in practice, if someone's coming in with really terrible joint pain, arthritic pain, or I know that they're inflamed, then they will do a trial of an anti-inflammatory diet. So we include all of these foods at the top: grass-fed or pastured meats. We usually do take out dairy, or at least conventional cow's dairy. People tend to have more luck digesting goat and sheep's dairy than they do conventional cow dairy. We use sweet potatoes to replace white potatoes, raw nuts and seeds. Green tea is amazing. Vegetables and fruits. Turmeric we'll get to. It's an amazing anti-inflammatory, especially for the digestive tract. Oils like extra virgin olive oil, coconut oil, grass-fed butter, dark chocolate, right? Eggs, bone broth is amazing for collagen production and to heal inflammation in the gut, especially for that leaky gut where there's intestinal permeability. Apple cider vinegar and herbs, some of which are included on this chart are mint, cumin, cinnamon, fennel, rosemary, and thyme. And garlic, of course. So we can send this, if you leave your email address, this is like throwing the kitchen sink at inflammation. Fish oils, bromelain. Bromelain is a proteolytic enzyme. So if you take proteolytic enzymes with food, it helps you to digest your food. Bromelain comes from pineapple. And if you take a proteolytic enzyme or bromelain away from food, it helps to reduce inflammation in other tissues in the body. Curcumin, sometimes we need higher doses of curcumin. You know, sometimes people can't have tablespoons of turmeric in everything that they eat every day. So we'll recommend a supplement, but otherwise having turmeric lattes is a great way to finish up your day if you want a tea before bed. Yes?
What would be the daily dose for a good healthy gut for the turmeric?
Daily in terms of a powder, or if you were to drink it, I would have like a couple of tablespoons a day. Yeah. And so if we want the effects of the turmeric to pass through the digestive tract into the joints, we combine it with black pepper. That's what you'll see in a lot of the supplements, and that's a traditional...
What if you're allergic to black pepper?
Ooh, if you're allergic to black pepper. Then you don't have it with the curcuma. Would you use cayenne? The black pepper is irritating to the digestive tract.
Yeah.
And so that irritation helps the turmeric pass through that intestinal lining to get out and to help the joints. And then the turmeric itself as an anti-inflammatory helps to repair the gut again. Yeah?
You had bone broth on the earlier slide.
Yes.
Does it matter what kind of bones you use?
Bones, it doesn't matter the type of bone necessarily, as long as the health of the bone is, the health of the animal was good beforehand. So
It's mostly the cartilage that you...
You want the cartilage, yeah. And you want the glycoamino portions to help repair. I think chicken feet are really high in collagen, so they can be useful. And it depends, if you get bigger bones, you can cook up more broth. There is something, and I forget what it is now, about fish bones. There's an affinity for fish bones, right? And healing the digestive tract in particular. But I'm sorry, I can't remember why. Yeah. So, make a tea with them? So the question is, can you take turmeric and make a tea out of it with something else or just on its own? With motherwort. You can, yes. You want to combine the turmeric does well with the fat too, so like a coconut milk. And motherwort I would use more as a tea or a water extract, but you can take them together. They interact in a negative way. You may want to take them at different times of the day. Yeah, because one you might want to use motherwort more at night and turmeric more in the afternoon or in the morning. Does that make sense? I have a patient right now who's using motherwort, and it's one of the major herbs that's helping them to sleep at night. And I used motherwort. I've retired from helping at labor and deliveries now, but in labor I was using motherwort quite a bit, and the shift in women taking a little bit of motherwort or Leonaris was really incredible. The way that a woman would just almost enter into her own self using motherwort. I use it a lot postpartum too. It's for the way that I see it is like a mother who's very caring, and any little peep from a child or a baby makes her jump. So it's really valuable in helping to build some resilience in the mum. Green tea we use a lot. Someone can drink a fair amount of green tea and get the beneficial constituents. There are also supplements that can be considered should we need a lot more care. Resveratrol is something that is listed here as an anti-inflammatory treatment. We find a lot of resveratrol in Polygonum cuspidatum. Does anyone know what that is? Japanese knotweed.
Oh my God, feels
You know Japanese knotweed? So you know we're using Japanese knotweed as one of the major treatments in Lyme disease.
Was that right?
Yeah.
Well, if they need some, I got.
Yeah, so it's huge. You know, John always talks about someone, if somebody wants to make a lot of money, you can go to people's fields or homes and dig out the Japanese knotweed and then sell it to a herbalist to make medicine.
Is it the root ball?
Yeah.
Oh.
But
I'm gonna go dig it.
it's so huge, right?
We can't kill it.
Yeah, I know. But we use it as medicine a lot. We're even using it. I brought a sheet, if people are interested. I just brought one, but I can pass it around. We're using it as an adjunct in our treatment just in case for coronavirus. So it's one of those things that's coming in handy. Yeah, and there's also resveratrol found in red wine. Yeah. I would really look for organic green teas, and I find you can taste the quality. I find with a lot of teas, sometimes I taste the tea bag more than I do the herb.
Yeah.
You know, so once you have something that has a lot of vitality and is really good quality, or if you grow it yourself, you know, then you'll find more benefits there. There's more of a spectrum, I think, of healing when something has more vitality. And the great thing about planting and growing herbs yourself is that all of that love that you pour into the plant is there when you harvest it and give it to others or take it yourself, right? Yes?
Just a question. You read something about green tea.
Yes.
And it can contain, I think it's lead or some other toxin.
Yes.
And there's certain parts of the plant to use. Could you be more?
I can't answer that. I'm sorry.
No, I heard it takes, there's an uptake from the soil of certain things, and maybe it's I don't know if the ones that come from China or somewhere else.
Probably, yes. It's hard to say. There's so much toxicity in the world right now, and I believe it. The question was whether or not there is lead in some green teas, and whether or not there's an uptake of lead from the plant, from the soil. And it's
part of the plant that was safe from that, but I can't remember what.
Oh, and there's a certain part of the plant that is safe. I'll look into that. That's really interesting. Thank you.
Well, I don't know if it's the same with the green tea. It's
Yeah.
like when we had the kale growing out closer to the main roads.
Yeah.
You actually pick up lead levels by planting near a road.
Right.
And it's just passing by, like, because years ago all vehicles had lead, so all
Yes.
that soil along the roadways
Yeah.
have lead in it, much
Right.
higher, but the kale at the back has nothing.
Did anybody hear that? So
It's
this person at the front is saying that with kale, if you plant kale by the roadside, and when we had leaded cars, the kale would pick up.
from lead
And
cars way back. You still get it in.
you still get lead in the kale grown by the roadside as opposed to further back. So I don't know if that's relevant to the green tea argument or not.
I heard it was in China, there's certain parts that was safe.
More things that we use, and we'll get to more of this. Boswellia. Quercetin is a supplement. Quercetin is also found in onions in high amounts. Quercetin we use a lot in inflammation due to allergies. It's a good anti-allergy medicine. Ginger. Ginger's that great warm, spicy herb. Great for, people talk a lot about curcuma or turmeric, but ginger is also a really great joint and digestive anti-inflammatory and anti-spasm, stop spasms. We have grapeseed extract, which is an extract from the seeds of grapes, helps lower blood glucose and help insulin receptors and diabetes. NAC is N-acetylcysteine. It's one of the isolated compounds that naturopaths use to help move the liver and increase glutathione. Pomegranate juice, vitamin E, and melatonin. These are a combination of both herbs and more supplements. So why don't we move on to more of the herbal medicine part of this?
I have a quick question before you move on.
Yeah.
Are there limits as to the quantity that you should take on a daily basis of what we just looked at?
It's best for the treatment to be individualized. So someone's constitution may have more of an affinity to ginger, let's say. But ginger is quite heating, right? And so people that have digestive upset or nausea, some people feel great using ginger. Some people feel worse, terrible. And because it's too hot for them, so they tend to do better with the mint, like peppermint. So since a lot of our inflammation starts out in the digestive tract, these are many herbs that we use in practice. I'm just going to highlight a few. So where am I going to start? Do you want me to go through the whole list, or do you want me to just choose a few? No. Do you want to choose a few that you're familiar with?
The
Yeah.
most common ones that you use.
The most common ones that I use, and you can make a tea from, right? You can go get some in your garden and plant it. So in terms of like a leaky gut, that intestinal permeability, I'll give you my combination that I use a lot in practice to help that. You can use it with kids, grown-ups, into, grandparents and such. So I use a combination of calendula, the common name is calendula, right? Bright marigolds, and filipendula. Do you know this? This is probably, for this talk, analgesic and inflammation. Filipendula or meadowsweet. Do you know meadowsweet is the plant for you? So calendula, filipendula, matricaria is chamomile. So those together, and sometimes with plantain, can help to heal a leaky gut. Calendula is, we call it a vulnerary. You know what vulnerary means? Vulnerary means tissue healing. So oftentimes you'll see like calendula creams, right? Because it helps to heal tissue. So, the lining of our intestinal tract is also made of epithelial cells, skin cells. And they're only one cell thick. That intestinal barrier that decides whether or not we should allow nutrients in or keep them out and get rid of them is just one cell thick. So if it gets damaged, it can affect the whole system. So calendula is really helpful at repairing not only the skin on the outside, but the skin on the inside too. And it's also antifungal, antimicrobial, and lymphatic, which means it helps to remove debris and toxins from the body. All of that from a little marigold. Can you believe it?
And can you use all the parts of the marigold?
I usually use the
Yellow
upper
part?
parts. Yeah.
The flower part?
The flower.
Flower part.
Filipendula is really amazing. It's called meadowsweet. And if I had to choose just one herb to help with acid reflux, especially initially, it would be meadowsweet. It helps to buffer the acidity in the stomach. So if there's too much acid being created, it helps to modulate that, or if there's too little, it helps modulate that. Yes? I'm going to get to that, yeah. Yeah, so the comment is, I believe that aspirin is a part of this meadowsweet or filipendula, and that's true. That's why it's a great for pain as well. So it has salicylates in it. So salicylates are that part of aspirin that are anti-inflammatory. The great thing about meadowsweet is that it also has other compounds to help for the stomach. You know how aspirin can be very hard in the stomach. So filipendula is actually healing to the stomach and the intestines, while at the same time anti-inflammatory and analgesic, or helping with the pain.
So how do you use it? Do you dry flowers or leaves?
Yeah, you can use the upper part and make a tea.
So just the flower part or leaves as well?
Leaves as well are okay. Yeah, yes.
So being that it's an aspirin
Like?
derivative, like, is it a blood thinner as well?
Not in the same way. Just, yeah, just just...
Is there a risk to people who would take an
No.
aspirin a day or
No.
a blood thinning concern?
No, it's not that.
Okay.
Yes,
So the 3 plants that you mentioned,
yes,
is it primarily the flowers of each of them that you use?
yes. The flowers in the upper portion, so the aerial parts above ground.
So that includes the leaves then? So you
Yeah.
just pick off the top few inches?
Yes.
Chop it up?
Yes, yeah, and make a tea, yeah. What else can I tell you? We'll get to filipendula down the way also. So it can be used not only, so if you have the pain in your gut, it's great to use. Acid, it's great to use. Bloating, great to use. And then these 3 also with chamomile. Chamomile's a great relaxer for the nervous system, so it helps us to calm down, right? But it's this modest little herb that has such a great effect on healing. We can use it, it's also what we call a vulnerary, so that tissue healing. It's also antimicrobial, so it helps to fight against infection. And it helps us to relax and sleep. For babies that are teething, I'll often suggest to moms that they make a strong chamomile tea and then soak like a washcloth in that and have the baby gnaw on it. Filipendula can be a great addition to that too, because it has those anti-inflammatory compounds, especially in a baby that has even more digestive upset, or people. What else is here that we use a lot? We use a lot of mint. Mint is cooling. Sometimes all people need, if they have a headache that's sort of climbing up, is a little bit of mint essential oil or tea. It can help just move things back down. Mint helps to disperse heat, so it helps if there's a lot of heat or fever in the core. It helps open up the pores and move blood to the periphery so we can sweat and get that heat out. That can sometimes be an issue with inflammation, right? It's like this heat that's stuck in one place and doesn't have a way to get out. And sometimes if we're exposed to too many toxins, or we might not be eating the right foods for us, or we may have a leaky gut, our liver, our kidneys, and our skin can be impaired, so these toxins don't have a chance to get out of our system. So by moving blood, exercising, saunas, using some herbs help to move the toxins out and can also help to decrease that inflammation. Yeah.
Is there a difference between using it just like raw, like just chewing on a mint leaf, or to put it in tea? Does it change its effectiveness?
I would say, not necessarily, it wouldn't change the effectiveness, but I would say tea gives us more water that can also help with moving things out of our system, right? Moving that water out of our system. Yeah, but sometimes, people use essential oils in diffusers, so just the scent or the volatile compounds in herbs can be healing. So chewing on a leaf can be effective. Totally, yeah. Rubbing a leaf on it, on an area too, right? Yeah.
Does marshmallow fall into this?
Yeah, good one. Yes, totally, totally. And we use marshmallow root usually for the digestive tract. It's very cooling, demulcent, for acid reflux and inflammation in the digestive tract. Good catch. I'm going to tell John. The leaf we use more for respiratory conditions, but the root, we make a cold water extract from marshmallow root. Has anyone ever heard of that before? Yes? Yeah. And so for marshmallow root cold water extract, you take a tablespoon or two of marshmallow root and then fill like a mason jar or a liter container with cool water. And leave that on your countertop or in the fridge overnight, and then strain it in the morning. And then you'll have this sort of mucilaginous, slimy drink. Yeah, it doesn't taste. It's kind of mild in flavor. It's just the texture is a little slimy. But that's what we want, right? Is because it helps with our mucus. And so one of the things that we often ask with the marshmallow root, or with someone who's going to use marshmallow root, is, and it can be helpful for that acid buffering in the system, and it can help cool all the way from the esophagus all the way down to the large intestine. Anyway, so sometimes when we talk about marshmallow root, we talk about the stomach and all of the acid in the stomach. So if we take hydrochloric acid out of the stomach and we put it on a piece of meat, do you know what happens? Or if we eat meat, it's the hydrochloric acid that digests that meat. So if we have this acid inside of us and we actually make it, what is it in our bodies that prevents that acid from eating us? Does anybody know? It's the mucosal lining of the stomach, right? It's that slimy stuff that stops the acid from digesting us. So thank you. Marshmallow root was a great...
Slippery elm works the same way.
Slippery elm does work the same way. Yeah, we tend not to use slippery elm as much because it's really hard to come by. It's really hard on the trees, and so we tend not to use that as much these days. The question is marshmallow also good for the kidneys? We tend not, the leaf is nutritive, so can be helpful and demulcent for the kidneys. What we tend to use now to help regenerate and rejuvenate the kidneys is nettle. Nettle, and especially nettle seeds. Nettle seeds can bring someone who's on the brink of kidney failure back. nettle seeds.
Stinging nettle?
Stinging nettle.
Yikes.
Stinging nettle, the seeds, yeah. Yeah. You've got to...
Took over 50 years of my mother-in-law stuff. We don't know what most
Amazing. Yeah, medicine.
before I knew what they were.
What do you do with the seeds?
Stinging nettle seeds, so you can dry them and make a tea with them. Put them with the nettles, you want to add some acid to them, so apple cider vinegar or lemon juice helps bring out more of the minerals. And same thing, just put them in a mason jar, leave them for a few hours or overnight on your countertop.
Apple cider vinegar.
Apple cider vinegar brings out more of the mineral content.
Is that for the leaf too?
For the leaf too, yep. We use the nettle leaf and red raspberry leaf a lot in pregnancy and to help toning the uterus, so that's what we recommend. Marshmallow leaf, red raspberry leaf, nettles, and rose or hibiscus.
And is that okay to drink every day?
Yeah, it's fine, yeah. Yes?
Could you talk a little about the milk?
The milk thistle. So this is the silybum, which is always fun to say. It's milk thistle, Marianne. And so milk thistle is a plant that helps rejuvenate the liver. So I tend to give milk thistle more in tincture. But I went to a course, she actually came to Viriditas, where I work with John, a woman named Isla Burgess, who's a herbalist in New Zealand. And she suggested using milk thistle seeds every day on your cereal, or like oatmeal or porridge, and how that can help detoxify the liver. So that's a simple way to use milk thistle in the detoxification of the liver. Yeah. The dose? Not really. Not really, unless you're planning. She's wondering if you have to worry about the dose of milk thistle. It doesn't tend to be a really pushy herb. It's more of a gentle detoxifier. So, you don't need to take a whole bunch of it for it to have an effect. But should you take, a couple of tablespoons of the seeds, it's not going to have an adverse effect. And I've never seen it really push too hard. Yeah.
Can you speak about the benefits of mulberry leaves?
Mulberry leaves?
Yeah.
Oh, I don't know. I'm not sure. I'm not up on mulberry leaf, but it's a good thing. Do you know much about it?
I believe it might be something that lowers blood pressure, but I wanted to. I don't know.
Lowers blood pressure and blood sugar.
I'm not positive. I need to.
You need to look at it too.
I just remember reading somewhere about
mulberry leaf.
Yeah, mulberry.
We use blueberry leaf and blueberries to help lower blood sugar and help in insulin resistance and diabetes. But I'm not sure about mulberry leaf. Sorry.
Something for me to learn.
Yes, me too. Always something new. So the immune system, sometimes people come to us when they've had an injury or they've had an admission to a hospital, and so they're put on all kinds of different drugs and they're ready to go off them. And so one of the drugs that people have a really challenging time with is corticosteroids. So there are actually a combination of herbs that we use to help people restore their adrenal glands and help them to slowly taper from corticosteroid drugs. So I'll give you the 3 herb combination. It's bupleurum, which is a Chinese herb, which really helps decrease inflammation and helps to move the liver and detoxify the liver. And that's a lot of how it works as an anti-inflammatory. Diascorea is the other one. This is wild yam. Wild yam is also great as an antispasmodic to help spasms in the body. So we use it in cases of gallbladder stones and that spasm. We use it in female spasms due to the women having their periods. We use it for digestive spasms if people have IBS. It's a really great herb. And then we also combine bupleurum, diascorea, and Glycyrrhiza glabra, which is Chinese licorice.
Is that for the steroid?
Yeah, those are the 3 that we combine to help people. People can't take corticosteroids out quickly because there's a rebound action that happens in the body. But those 3 herbs, not only do they help keep the inflammation down, but they also help our adrenal glands, which are these glands that sit on top of the kidneys, and they help them to rejuvenate themselves again. So those 3 herbs are helpful to tropho-restorative, or they help to restore the body's own organs for inflammation. What else do we use a lot as an immune anti-inflammatory? We'll probably see curcuma or turmeric on every list of these anti-inflammatories. Salix alba. So we were talking about filipendula before, and it having salicylic acid, ASA, is where aspirin came from, is made up of salicylic acid. And this is Salix alba is white willow bark. And so that's where they actually were able to synthesize aspirin from that bark.
Is it different from black willow?
Yes. Yeah.
Is white willow okay to take on the stomach?
White willow bark, yeah. It tends not to be as irritating on the stomach. But should you want a herb for inflammation in the stomach, I would give filipendula, because it helps to restore the tissue of the stomach at the same time, whereas white willow bark doesn't tend to do that as much.
Say you had a headache and you want to make a tea. Would you go meadow sweet or willow?
I'd probably still go meadow sweet. Yeah. Yes.
Is white willow bark the same as pussy willow?
No, not the same. Thank you. The last herb that I want to highlight here is Sambucus nigra. Do you know what that is? It's elderberry. Yeah. So I used a lot of elderberry this winter with patients. Yeah. And it's also one of our best antiviral herbs out there. The berry we use as an antiviral. The leaf we use as a diaphoretic to help with the fever. So it helps the blood move again from the core to the periphery to let that heat out. Sambucus or elderberry along with this one, Scutellaria bicalensis and Polygodum cuspidatum, are like the first treatments that we have for the coronavirus right now.
Sorry, what was the third one?
Oh, Zambucus Scutellaria bicalensis. This is Chinese skullcap. Chinese skullcap. I use it a lot to reduce heat in the body. It's good for too much histamine or an allergic reaction, redness and heat. So that's why we're using it as a part of the coronavirus protocol, to get rid of the heat that tends to build up with the virus.
So, sorry.
Yeah.
So you said elderberry, the Chinese skullcap, and what was it?
And Polygodum cuspidatum, Japanese knotweed.
Oh, Japanese.
Yeah. We can send you or I can pass around a handout. I hope I printed it. Yeah. So this is our worksheet if you want to take a look. Yes, yeah.
Was that if you catch it or a preventative?
It is a preventative.
Oh, okay.
Yeah.
Great.
So that's sort of first line preventative and treatment, first line treatment, and then there are other herbs that we use for should there be an active infection and post-infection symptoms, or secondary infections, co-infections.
So with the elderberry, there's no. I've been reading a lot on it lately because I do it to myself and my family all the time. But there was recently some articles saying that it can actually affect your, like it can create an autoimmune reaction. So I just wonder, because now I'm confused, should I be giving it as a preventative or should I not be?
So the question is whether or not elderberry can make the immune system overact. And is there any caution about that? I haven't seen that in practice. I don't tend to give elderberry on a daily basis in someone whose immune system is not compromised, right? But in some, if I know that someone is about to go on an airplane, or a child that's about to start in daycare or at a new school, I may give elderberry just to help build that resilience. For immunomodulation and activation in clinic, and John didn't write them down here, but we tend to use medicinal mushrooms a lot more. Reishi mushroom, chaga mushrooms, kind of thing. Yeah. Moving on to the nervous system and the doula or pain. So when we have a lot of inflammation, fluid buildup, oftentimes we get pain and we can't sleep. So a few things to highlight here. Pulsatilla, anemone pulsatilla is, what's the common name?
Windflower?
Windflower, yeah. And so that I use a lot for like ovarian pain, hormonal pain. Atropa belladonna, you want to come and see a herbalist if you're going to use that. Wouldn't recommend using that on your own. It's very powerful. You take it in very, very small doses, often with a spectrum of other herbs, or as a homeopathic. Corydalis is a Chinese herb that we use quite a bit to help people to sleep and reduce pain. Datura, again, is not for everyday use. That is to be administered by a herbalist or medical professional, not on your own. Schultzia. What's a Schultzia? A Schultzia is California poppy. So this California poppy, it really helps people to sleep and with pain, especially if there's like mental anguish going on. So we use it a lot for like the brain that can't sleep, to help calm it down. For people that can't sleep because they're having muscle spasms, or they've just done a lot of running or exercising and their muscles are spasming, we use valerian a lot.
Would that be good for Parkinson's spasms? Maybe not.
It comes from a different place, right? That's more neurological than it is musculoskeletal. Valerian is really a wonderful nervine. Sometimes people, all they need to do is smell it to fall asleep. We have to, when we're making valerian tincture at Viriditas, we have to open all of the windows and doors because we're in a building. It's not even for us falling asleep, but the people, we're in a building and there's like a few different floors, and so we were getting complaints from upstairs in the building that they were getting sleepy. Plus, after a while, I mean, initially I quite like the smell of valerian, but after a while it just it smells like stinky diapers after a while. But it works.
When you're using valerian, are you using the whole plants or just the roots?
The upper part, yeah. Yeah. And valerian, we combine often with skullcap and passion flower, passiflora, for musculoskeletal pains where you can't sleep. And then we combine a Schultzia or California poppy with skullcap and passion flower for that like anxious mind that can't sleep.
Can one get immune to it over a while?
To valerian?
Yeah. I used to take it all the time. It worked wonders, and now it does nothing for me.
Oh.
I've taken a break from it, but just wondering if you can just...
Yes, I mean, with any herb or condition, unless we're using it really as a nutritive, and that's what this talk is sort of, I think it's supposed to do, is we need to try to address the underlying cause, right? So if it is a pain that's keeping you up at night, if it is a stress or a job that's keeping you up at night, or a lifestyle, maybe your muscles are tense because you're working them too much. It's like we can use the herbs to help us, but at some point we need to address what are we doing to ourselves and how can we shift either our daily life, our routines, or make a shift in our emotional self or our consciousness to address the underlying cause. Herbs are wonderful at helping us, and they're great tools, but they're not the only thing that we can do. So if a herb is working for a while and then stops, what can we do? And what have we changed? Or are we just relying on that herb, right? Yeah. There's a difference in terms of like a nutritive, something like nettles or nettle leaves. Seaweeds, I also find, medicinal mushrooms, they're more nutritive, so it's like they're feeding our system like a food, right? That could be another reason why someone's not sleeping. Maybe their blood sugar, or they're waking up, their blood sugar might be dipping at night, so we want to address those causes too for the reasons why people are having insomnia. Okay? calor. So let's remember, what's calor again? That's the heat, right? So we want to use anti-inflammatories. So we see a lot of the similar herbs that we did in the last list. But the last list I didn't highlight lactuca. So lactuca is wild lettuce. It's really prickly, but it works wonders. Sometimes people call it has latex in it, and people used to call it lettuce opium. So it really helps to decrease pain in the body, inflammation, and to help us to sleep. We can also use the latex in the plant to help with warts, cover up warts. What else do I have? It can be for insomnia, restlessness, too much excitement. It's not a herb that I tend to go for first. It's a little more powerful than, let's say, Scutellaria, which is skullcap, or valerian. So it might be something that I would go for as a little bit of a stronger push, but it's also excellent. Hypericum. Do we know what hypericum is? Anyone?
St. John's wort.
St. John's wort, yeah. So St. John's wort is a really amazing anti-inflammatory, especially for the nervous system. It can help to regenerate nervous tissue. And there's a case of someone whose hearing was losing their hearing because of a degeneration in the nerve. And so by putting hypericum oil into the ear along with garlic and mullein, it helped someone regain hearing. There's also a case where someone sliced their finger and had really bad nerve damage in their finger. And we gave them hypericum oil or St. John's wort oil, and the nerve signal and tissue came back, so they were able to move their finger again. So hypericum is a really amazing herb for that. These days we see it in a lot of studies for depression, right? But historically they would use it a lot for the liver and to help with inflammation in the liver, and to help with nervous system conditions. Here we have salix again, or white willow bark. Piper methysticum is something that we use all the time for anxiety. It's kava, and it's a root from Polynesia. And we mix it with coconut milk and drink it as a tea. It's also a really great way to help people to sleep and relax. Sometimes we call it a social lubricant because while it doesn't, so we use it sometimes like in herb gatherings and parties, we drink kava. And what it does is it helps to relax us enough to speak freely without making us fall asleep. So it's a really good herb. I don't know what time it is. It's after 3? 20 past 3. Oh my goodness. How are you for a few more minutes? Yeah, okay. So This just talks about different types of pain that are registered in our body. There's nociceptive pain and neuropathic pain. Nociceptive pain, do we really need to talk about this, is registered more in the tissue organs. And so when we feel pain, it has to do with the body part, or the like joint pain would be a nociceptive type of pain, whereas neuropathic pain is more an injury to a nerve itself. So something like carpal tunnel would be injury or inflammation in the nerve itself. Something like trigeminal neuralgia is inflammation and injury to the nerves themselves. So we have a couple of treatments, particularly for trigeminal neuralgia. We'll use an anti-inflammatory like hypericum oil. So hypericum, if you want to make it's a beautiful plant, St. John's wort. I called John Redden every day on St. John's Day when the St. John's wort is blooming and send him a picture of hypericum. But we infuse safflower oil with hypericum, and it's amazing because when you make an oil, if you look at hypericum, the oil and even the tincture turns red. So the components in it are red. So with safflower oil, the hypericum just makes this beautiful red-colored oil that you can rub on tissues or on the nerves that may be involved in trigeminal neuralgia. We also use boswellia. Pelargonium is geranium, and lavender to help cool the nerves and decrease inflammation. Just a note on boswellia. Boswellia is frankincense, and frankincense is super anti-inflammatory, and it crosses the blood-brain barrier. So if there's any inflammation in the brain, in the nervous tissues, we use boswellia. We even make a roll-on of boswellia so that people can rub it on their heads. And we've had people that have tumors in their brain, and they, along with other things, but part of the treatment is the boswellia, the tumors get smaller. It's really powerful. There's a reason why the three kings gave frankincense, right?
How do you get it from that crystal state to a roll-on?
To a roll-on, we just have the essential oil. We don't make that part ourselves, yeah. And then we dilute it. So our time is up. I haven't finished the slides. Do you want me to quickly run through them? Do you want to have some questions? Yeah, you want me to quickly run through the slides? Yeah, okay. Sciatica is a nerve pain where the sciatic nerve gets blocked in down the leg. And oftentimes we feel that pain all the way down into our foot. Along with changes in movement, we can use anti-inflammatory oils of hypericum, St. John's wort, and boswellia again, and apply along the sciatic nerve from the origin to where the pain ends. So we trace the nerve all the way down. that can really help. And then you want to apply that and reapply it every 4 hours. I wouldn't recommend making this yourself or even using it yourself. The datura oil, you want to come to someone, again, that's for severe cases. The only time that we really use datura for sciatica is someone who is really in terrible shape. Oh, for oral pains, what's great is syzygium. Syzygium is clove. Has anyone ever just taken a bit of clove and put it in their mouth to help with, tooth pain? Tooth pain is the worst, I find. I can handle many other types of pain, but teeth just makes me go crazy. So syzygium, you can take a clove and put it in your mouth, or you can use the essential oil of clove. You don't want to use very much, just a couple of drops in a carrier oil like coconut oil or avocado oil, grapeseed oil, and then just rub it on the area. We use this for kids who are teething too, just a little bit, couple of drops. Test it on the adult first and then rub it on the gums of the baby. Topical capsaicin for pain. These are like topical cayenne packs that help warm the area and can really help with back pain and spasm. Helps by bringing more blood and circulation to the area, and it also helps to dull the nociceptors from registering the pain. That's what this slide says. But I'm gonna flip it.
In a nutshell.
In a nutshell, yeah. Hot and cold. So this is like a lot of the Chinese ointments or traditional Asian medicine ointments are made with a combination of both heat and cooling. We love to use populus for that arthritic type cooling pain. It helps to cool the area and has beneficial effect for muscular aches, pains, and spasms. And then you can also use a combination of capsaicin, which is cayenne, heating, eucalyptus, cooling, cinnamon and camphor, mentha, cooling, and cinnamon cassia, which is again heating. So there's this relationship between the movement of blood and then cooling. Populus? Populus resin, what's the common, what is it?
Cottonwood.
Cottonwood. Thank you. Female reproductive analgesics, I highlighted a few things. Again, we see anemone, pulsatilla, Ascholzia, the California poppy, lactuca, matricaria, chamomile, salix, and valerian. One note about valerian, sometimes people that are really hot, sometimes people react poorly to valerian because it's a warming herb. So sometimes people who have more heat, especially in the head, or tend to be more hot-tempered, may not do as well or feel more agitated taking valerian.
So that kind of goes back to what I was asking about earlier. So if a person normally has a cold constitution, that say is going through menopause, is having hot flashes,
right?
Could valerian then change for them?
So the question is, if someone regularly has a cooler constitution and has been using valerian, but they may be going through perimenopause or menopause and they have more heat in their body, would valerian then be a herb that they would use, or it might stop working for them? It's possible. Yeah, it's possible. The male reproductive anodynes or pain reducers, the anemone shows up again, cordalis, lactuca, we covered, that's wild lettuce, that lettuce opium. Piper is kava kava, the social lubricant, antispasmodic. We use piper a lot for people who are passing kidney stones too. It's anesthetizing to the urethra. So that's an interesting part of that. Pisidia is quite strong. That's Jamaican dogwood. Also very helpful. It's one of our stronger analgesics too. And then there's populus. Musculoskeletal, I think we covered most of these. Well, arnica we don't take internally. Arnica we only use externally, but it's amazing at healing bruises, contusions. You just don't want to use it over broken skin. But in terms of inflammation, especially inflammation due to trauma, arnica is amazing. Internally, I would only use it as a homeopathic. Musculoskeletal anti-inflammatories. So when there's too much toxicity in the body, sometimes our joints can pay the price. And so then we might like to use, I'll be quick, Apium graveolens is celery seed. Celery seed is amazing for gout. Gout. And for a buildup of uric acid in the system.
That's the apium.
Apium graveolens, yeah. And we also use that to help clean out a lot of acidity around the joints in like rheumatoid arthritis. But it's like star that one in cases of gout. Boswellia we see again. Capsicum is cayenne. So cayenne we take to warm things up and to move blood. Curcuma, anti-inflammatory. Dioscorea, wild yam as an antispasmodic. Filipendula and salix are here in the musculoskeletal system. So if something is just like overtly joint pain, we might want to use something like salix or white willow bark. But if it's accompanied by digestive pain or distress, then I would choose filipendula. Osteoarthritis. Yeah, in osteoarthritis, we want to try to decrease inflammation systemically. So we want to try to use like curcuma and ginger. We want to try to move the liver and really address the digestive tract for that. The other thing is the bone broth for osteoarthritis to try and help those bones. And if it's osteoarthritis due to like repetitive stress, we need to try to figure things out in terms of how someone can, I had a father who played hockey for so many years, and it was like, his knees were falling apart. He had, I think, about 5 knee surgeries so that he could play hockey. Then a back surgery, maybe 3, so that he could play hockey. Yeah, so it's like, well, maybe your body's telling you to stop playing hockey, but it was enjoyment. Can I just say one more thing about tendons and ligaments and joints? There's one more thing that I find really helpful right now. Is Polygonatum multiflorum, which is Solomon's seal. So the roots of Solomon's seal we are using now to help ligaments and tendons find their elasticity again. And also to help with, in osteoarthritis, to help with the lubrication of the joints. It's Polygonatum multiflorum, which is Solomon seal. I had, maybe a couple of years ago, my right knee started clicking. And I was like, here I go, slippery slope. And so I took the medicinal mushrooms and I added Polygonatum to that formula. And I would say 2 weeks, maybe, I felt major improvements. So for any ligaments that are drying out, or ligaments that are torn even, or just, in cases where our bodies are getting older and we just don't have that resiliency anymore, the Solomon seal has been amazing. Yeah.
Is it taken as a capsule or a...
I use it as a tincture. I haven't seen it in capsules.
So would that be good for somebody that just had ACL surgery?
Yeah.
Okay.
Respiratory system, where's Zambucas? It's not there. Oregano is a great antimicrobial for the respiratory system. Pimpinella we use a lot, anise seed for flavoring and also to help with respiratory distress, especially in children. Verbascum is mullein. Do you ever use mullein? Mullein leaf is really demulcent and soothing for the respiratory tract. So that's one that I would highlight. Mullein leaf. Oh, Verbascum thapsus. Mullein is a beautiful plant. It's a biannual. So we use the leaf in respiratory conditions, and we use the flowers. You can pick the flowers from mullein and put them in olive oil. Traditionally there were baskets that women would wear and pick the flowers, put them in olive oil, and then we use that, and then strain them after a few weeks. And that oil is then used for the ear infections. It's great. Most ear infections are not bacterial, even though most people are given antibiotics when they go to the doctor. Mm-hmm. They're often caused by a virus or by too much fluid in the eustachian tubes. And so mullein is a great lymphatic. It helps to drain the eustachian tubes. And it's also antimicrobial and demulcent, soothing. So we often use like a warmed mullein ear oil. Usually we put garlic in it too, and put a few drops in the ear, and kids notice a difference. It can be within minutes. Mm-hmm. It's amazing.
So sorry, with the leaves, what do you do with the leaves?
The leaves, you can use them as a tea. Yeah, dry them and use them as a tea. Some herbalists use the root in musculoskeletal problems, but I haven't used it. I don't know. We also call the leaves, my daughter loves it, nature's toilet paper, because they're so soft.
That's awesome. That's good.
Urinary anodynes, we talked about Piper as being anesthetizing to the urethra. Mm-hmm. And then we see a lot of the similar herbs there. Urinary anti-inflammatories. What can I highlight here? We talked about apium already in cases of gout, too much uric acid in the body. Arctostaphylos uva ursi is Uva ursi, and it's a classic herbal remedy for urinary tract infections. Solidago, which is goldenrod. Goldenrod is amazing as an anti-catarrhal, so it helps get rid of that hard, sticky mucus, both in the respiratory tract and in the urinary tract. And then for urinary tract infections also, we use marshmallow root, that cold water extract, as a tea to help soothe the tissues.
So for the apium graveolens,
Yeah.
can you make it as a tea?
Yeah.
A tea.
Yeah, yeah, yeah.
And what is that one again?
Celery seed.
So the celery seed you would make into a tea for gout?
Yeah,
Just take the seeds and hot water.
yeah. You can,
I
yeah.
know someone who's got gout.
This is an arthritis salve, so it uses some cooling elements and warming elements. So this is, if you want to make your own, this is a good place to start.
EO is essential oil.
EO stands for essential oil. Yeah. Benzoin is just used as a preservative. So it just helps as it's herbal and it's natural, but you don't necessarily need it if you're going to make a salve yourself. Yeah?
What kind of oil are you using for the St. John's wort of Feast oil?
We use
You were making it as olive oil?
olive oil is fine. We generally use safflower oil.
Oh, really?
Yeah.
Okay. Thank you.
Is that just because it's light?
Because it's light and it doesn't.
High temperature.
Yeah, it's not, and olive oil has more of an odor, whereas safflower doesn't. And the safflower oil helps bring out that redness. Topical anti-inflammatories. This is the Boswellia essential oil again that we use on people's heads. People rub it on their joints. It's quite effective right away. Smells really good, I think. Yeah.
Frankincense is on the endangered list. I see a lot of it. Is healing chrism good substitute?
Good question. I don't know the answer to that. Yeah, but thank you for pointing that out. Yeah. Frankincense is on the endangered list. So can the heliochrysum be a replacement? I don't know, but we better look at that. Right? Yeah. The second one, heliochrysum. Can you speak about heliochrysum at all? It's a herb. It wouldn't be a resin if it's, yeah, herb everlasting, I think is the name. Oh, what is it? Pearly everlasting. Yeah. I don't know, but thank you. Yeah. Oh, last thing, if you're in the woods and you happen to run into some poison ivy, we use, impatiens are usually growing next to poison ivy. Impatiens capensis. So we often make an oil, or you can even break off some of the leaves or the stalk, and it's really soothing to tissues, soft and demulcent, and it can help reduce the heat and symptoms of a poison ivy rash. So when we make the oil, we use impatiens, and we also use lavender, which is very calming and soothing. Again, Boswellia and benzoin. That's just for us to keep it on the shelf. Oh, I made it. So thank you for staying. Thanks for listening. Thanks for spending this beautiful day here. I hope that it inspires you to visit the garden and bring some things home.
At Richters, it's not just a garden, it's a whole new world. For herb plants, seeds, veggies, and more, visit us at richters.com or call 1-800-668-4372.